Today we have a groundbreaking discussion that will challenge everything you thought you knew about diabetes. In this video, we are going to look at the two strategies that hundreds of people are using globally to reverse diabetes. But first, what is diabetes? Diabetes is a medical condition characterized by high blood sugar levels due to the body's inability to produce insulin or to effectively use insulin. Insulin is a hormone that is produced by the pancreas, and it helps with the metabolism of carbohydrates and also helps glucose to enter into the cells to produce energy. There are basically three types of diabetes: type 1, type 2, and gestational diabetes. Type 1 is diagnosed in childhood or adolescence, and it requires lifelong insulin therapy. Type 2 is the most common form of diabetes, and it is caused by genetics or lifestyle factors. Type 2 occurs when your body becomes resistant to insulin. The third major type of diabetes, which is gestational diabetes, occurs during pregnancy, and it resolves after childbirth. Some of the symptoms of diabetes include frequent urination, excessive thirst, unexplained weight loss, increased hunger. Other symptoms are tingling in the hands and the feet, a tingling sensation or a kind of numbness. We also have slow healing wounds, frequent infections, blurred vision. But in this video, we are focusing on how to reverse type 2 diabetes. Is type 2 diabetes truly an incurable progressive disease? Or have we been looking at it from a wrong perspective? It's time we debunk the myths surrounding type 2 diabetes. Contrary to popular belief, this disease is not a life sentence. Many medical institutions have labeled it as a chronic progressive disease, but this is simply not true. So if diabetes is a reversible disease, what has been missing in conventional approach to treatment? The key lies in understanding that diabetes is primarily a disease of insulin resistance and not just high blood sugar. Unfortunately, current medical treatments focus on managing blood sugar levels rather than addressing the underlying problem. Do you know that a staggering 80% of the damage done to our arteries, our hearts, our brain, and our kidneys are caused by high levels of insulin, the constant elevation of insulin, called hyperinsulinemia? It's time we shift our focus and redefine what truly harms us. Remember, it's not just the sugar we need to worry about. It's the elevated insulin levels that silently destroy our bodies. In fact, they can promote weight gain and further increase insulin resistance. It's time to face the truth. Medications, including insulin, does not effectively treat the disease. We've been giving more insulin to a disease state that already has too much insulin. It's like giving alcohol to an alcoholic. What do you think would be the end of that? So what can individuals with type 2 diabetes do to reverse their condition? The answer lies in understanding that type 2 diabetes is fundamentally a dietary disease. So we adopt two major strategies. Number one, by cutting out sugar, refined and processed carbohydrates, grains, potatoes, breads, etc. Also, adopting a low-carb or ketogenic diet and eating whole foods with fiber. Fiber-rich whole foods slow down sugar absorption. The fiber in our foods also feed the beneficial bacteria in our gut, producing short-chain fatty acids that improve insulin resistance and our overall health. So I want to give you my simple rules for eating. Number one, real food does not come in a box. If it comes in a box, it's not food, it's a product. Number two, eat only when you are hungry. Don't eat if you are not hungry, no matter what the time says. The first strategy is great, but to truly reverse diabetes, we must address insulin resistance as well. And how do we do that? The answer is fasting. Fasting is a powerful tool to lower insulin levels and burn fat. Fasting allows your body to deplete its sugar stores and shift to fat burning mode. Billions of people around the world have been fasting for centuries as part of their religious practices. It's time we embrace its benefits for our health. There are several studies that confirms that fasting and low-carb diet is the surest and fastest way to reverse type 2 diabetes. Check the description box below for links to these studies. So, will you not prefer to subject yourself to some periods of inconvenience, fasting, cutting down your carbs for some months, and eventually having your diabetes reversed and stopping all those medications? Contrary to popular belief, fasting does not lead to starvation mode. Studies have shown that during fasting, our body activates growth hormone to preserve lean muscle, increase adrenaline for more energy, and utilize fats as a fuel source. But note, if you are on insulin or other medications for seriously uncontrolled diabetes, you must be closely monitored when doing any fast, so you need to work with your physician. Now, if you need a guide on how to safely do intermittent fasting as a diabetic, I want you to let me know in the comments below with the phrase "I need a guide," and I will make it available in my next video. Please like, share, and subscribe to this channel for more empowering content. Stay healthy. I'll see you soon. Thank you for watching.